California's COVID-19 comeback a troubling trend. The Golden State is facing a resurgence of COVID-19, and this time it's fueled by a new variant called Stratus. As health officials grapple with this unexpected rise, the situation is further complicated by the Trump administration's controversial decisions and delays surrounding vaccine rollouts. Wastewater warnings and hospitalization hints. Public health departments in Los Angeles and Santa Clara counties have sounded the alarm, reporting increased coronavirus concentrations in wastewater. Additionally, LA County has noted a slight rise in COVID-19 hospitalizations. Dr. Peter Chin Hong, an infectious disease expert, confirms there's a lot of COVID out there, and it's arriving later than last year. Testing trends and outpatient increases. The positivity rate for COVID-19 tests in LA County has jumped to 12.6% from 7.6% a month ago. Similarly, Orange County has seen an increase from 8.1% to 14.4%. Dr. Elizabeth E. Hudson, an infectious disease specialist, reports an uptick in outpatient cases, especially among children, as schools reopen. We're expecting to see more COVID cases in children over the next few weeks, and this trend is already evident in some parts of the country. The Stratus subvariant, a new player in the pandemic. Dr. Hudson reveals that the Stratus subvariant, nicknamed XFG, is the dominant strain detected in wastewater. It's another Omicron subvariant, so previous infections with other Omicron variants may provide some residual protection, but it's not foolproof. You can still get reinfected. A summer of COVID, less intense but still present. Despite the rise in cases, this summer's COVID-19 season has been milder compared to last year. COVID-19 hospitalizations in LA County are approximately half of what they were during the same period last year. Similarly, emergency room visits related to COVID-like illnesses in Orange County are less than half of last. We're awaiting FDA licensure, which may result in later availability in September compared to last fall. FDA's role and potential limitations. County health officials note that the FDA could further revise or limit who can receive the annual COVID shot, as indicated in May. The California Department of Public Health warns that federal decisions on licensure approvals and recommendations may result in limited availability and delayed timing of specific COVID-19 vaccine products. The impact of federal indifference. Dr. Matt Willis, former public health officer for Marin County, describes the situation as an unfortunate limbo created by an administration uncommitted to vaccines. He writes, "We're stuck between the slow shutdown of 24-25 vaccine availability and access to the 25-26 version. Vaccination recommendations and risks. Dr. Chin Hong recommends that anyone at risk of severe COVID-19 complications who hasn't been vaccinated in over a year should get inoculated now. This includes individuals aged 65 and older, those with compromised immune systems, pregnant women, and infants and children aged 6 months to 23 months. Children aged 2 to 5 are also at higher risk of complications compared to older children." Navigating vaccine uncertainty. Chin Hong describes the delay in formulating a COVID vaccine plan for the fall as weird, emphasizing the importance of preparation in public health. Typically, health officials would already be urging people to plan for a fall COVID vaccine. However, this time, there's uncertainty about eligibility, with only those aged 65 and up and younger individuals with chronic health conditions being clear candidates. The new normal. A vaccine and an illness, but not as we know them. Chin Hong expresses frustration, saying, "It's as if officials are talking about a new vaccine and a new illness, but the COVID-19 vaccine has been around for over 4 years. The federal government's anti-vaccine stance. The federal government's treatment of COVID shots is not isolated. Kennedy, a vocal critic of mRNA vaccine technology, has ordered the firing of all 17 experts from the CDC's influential Vaccine Advisory Committee. Additionally, a person leading a committee to review the safety of COVID vaccines for the CDC has described the shots as the most failing medical product in history. The impact of vaccine skepticism. Kennedy's leadership over the Department of Health and Human Services, which oversees the FDA and CDC, has caused a split in the medical community. Mainstream organizations like the American Academy of Pediatrics are now issuing their own vaccine recommendations. For example, the CDC previously recommended that everyone aged 6 months and older receive an updated COVID vaccine in the fall. However, the CDC recently offered no guidance on whether healthy pregnant women should get the COVID vaccine, while the American College of Obstetricians and Gynecologists recommended that people receive an updated COVID-19 vaccine or booster at any point during pregnancy, postpartum, or while lactating. Conflicting guidance and public confusion. The Orange County Communicable Disease Control Team expresses concern, saying, "The COVID vaccine situation is unsettling. Differences in guidance from the CDC and other medical professional groups will be challenging for the public." Conclusion. As California faces a COVID-19 resurgence fueled by the Stratus variant, the situation is further complicated by federal delays and policy changes. The uncertainty surrounding vaccine rollouts and conflicting guidance from medical authorities adds to the challenges health officials and the public are navigating. With the potential for limited vaccine availability and changing recommendations, the path forward remains unclear.